They want to get you in, make it look like they've helped you, and then get you discharged.
In May, we showed you a series of failings at a mental health hospital in Gloucestershire. Staff asleep on the job, patients going missing, one discharged while saying they were suicidal, then jumping off a bridge, breaking multiple bones. And we knew of one patient regularly climbing on the roof. And for the first time, that person, Nikki, has agreed to talk about her experience in Woodland Lawn Hospital.
In the last 10 years, I've been up and down off that roof using the same route to climb hundreds of times.
Nikki did it to clear her head, but also once attempted to take her life on the roof. And we know another patient who jumped off during a psychotic episode. This, and images we've been sent of staff asleep on the job, raises concerns about the level of attention being paid by staff to vulnerable patients.
And are they always falling asleep at night, or can it happen any time?
During the day. I've seen sleeping the staff at lunchtime.
A whistleblower told us that agency staff were sometimes coming straight to work at Woodland Lawn, having come off shift elsewhere. And Nikki says the irregularity of agency staff means it's harder to form relationships, but there's also no consistent focus on the root problems that lead her to self-harm.
They haven't taught me a different way of coping. They haven't taught me how do I ask for help.
So, Nikki, do you mind if I ask you, why do you self-harm?
I have autism, and so I copy what other people do, and I'd copied my twin sister, who's since passed away, and that's how I'd learned originally how to self-harm.
Nikki lost her twin sister Laura to suicide after she was also a patient at Woodland Lawn. An inquest found the hospital had failed to pass on crucial information about Laura to another hospital, leading to a fatal mistake.
Since being in hospital, through other patients directly telling me, I've learned these new methods of self-harming that are more severe, have more complications. And if I hadn't been in hospital, I wouldn't have known about that.
Last week, the government launched a suicide reduction programme, noting it was on the rise among young people, along with self-harm. Clearly, focus needs to be on the care of those like Nikki most at risk. A review of her care last year found her suicide risk increased after she'd been admitted to hospital.
Each time I go into that hospital, my admission is a little bit longer each time, or there's a new method of self-harm that I've learned, and it's mentally draining. You come out of hospital thinking that there's no hope. If this is going to be my life for the next 20 years, if I'm going to be in and out of hospital and this is how they're going to treat me, and they're not going to fix the cause of my issues, then what's the point? And then you go back to thinking, what's the point in anything? What's the point in living?
In a statement, the hospital trust said, "We regret that our patient and their family are not satisfied with the services we provide. We constantly review our policies and procedures. For example, we have a range of anti-climb measures in place, and these have been reviewed and strengthened in recent months. Reports of sleeping on duty at Woodland Lawn are very rare indeed, but when these have arisen, we've taken robust action." They also say a recent recruitment drive has reduced the need for agency staff.
I am a human. I have a mum. I am a daughter. I'm a sister. My family do want me to live. And it's hard for me because there's that battle.
Do you want to live?
No. Not really. And I think that goes back to that each time I go into hospital, I lose hope.
Nikki was discharged from Woodland Lawn not long after this interview and attempted to take her life. She was saved in intensive care. I spoke to her and her stepfather a few days later over Zoom from her hospital bed.
So all these things were predictable. The family warned about it. Nikki even said she felt that she was at risk.
An independent review of her care on Discharged expressed great concerns, saying they were not at all confident with her outpatient care plan.
I thought maybe the services would step in and help and make a difference, but it just seemed like they got further and further away.
Nikki is now back in Woodland Lawn, back sending me photos from the roof. The Trust says it can't comment on individual care plans due to patient confidentiality, but their focus is on safety and well-being. Jason Farrell, Sky News.